Hi, everyone. Thanks so much for joining us today for a special live Q&A about COVID-19 and children's hearts. What do we know and what are we learning about this virus and how it impacts kids with typically healthy hearts, but also those with serious heart disease? So we have two pediatric cardiologists from our children's team with us today, Dr. Jean Ballweg and Dr. Adam Pacheco. Thank you guys for being here.
You bet.
Thank you.
So we have a lot of questions about this topic, in general, but especially as it relates to your specialty of the heart. And we want to invite your questions while we're broadcasting live. You can put those in the comments below as we go. And we also want to say thank you to a lot of our community members who have already shared wonderful questions that we will be covering as we go through the conversation. So let's just start very broad. Does COVID-19 have an impact on a child's heart or a teen's heart if they get the virus? What do we know and what are you seeing?
So Sarah, we know that there can be an effect on the heart in the pediatric population. Much of our initial concern was generated from the data that we have from the adults and certainly from the experience in China. And so for the adults in China, when Wuhan was first publishing their data, more than 20% of the adults were having something called myocarditis associated with acute COVID. And that's inflammation of the heart muscle, which can result in dysfunction of the heart in the adult population. And we certainly can and do see that in our pediatric population with COVID. We are seeing it not only with acute COVID infection, so the initial infection and presentation with the virus, but also in the kids who get the post-inflammatory syndrome, which we call MISC. And although it's very infrequent, it is something that we are experiencing here at the Children's Hospital and Medical Center.
Our cardiology and heart surgery teams care for a lot of wonderful children with very special hearts. And we got a lot of questions from the parents, the people who love those kiddos, about what do we know about not only the normal functioning heart, but those kids with CHD or another condition. So Erin asked from Facebook, are you seeing any kids with congenital heart disease doing worse than kids with healthy hearts when testing positive for COVID-19? And she said specifically single ventricle.
So again, we've been able to pool our data, and as a children's hospital with an active cardiac surgery program that deals with single ventricle patients, we're part of a national collaborative. And so when we look towards the data of more than 70 hospitals in that collaborative, we are on par with those other institutions in that we are not seeing that our kids with congenital heart disease are necessarily having more frequent infection or more serious infection that is requiring hospitalization. Just looking at our hospital single ventricle population, speaking with Dr. Curzon, who is one of the physician leads for that patient group, we've had one known positive COVID patient in the interstage period for single ventricle palliation, and that patient was managed at home. We've had one patient who was in the hospital here with acute COVID infection, which was treated, who was also interstaged. And that patient has also gone home and did very well. So although we think of them as a higher risk population because they're fragile at baseline, and many of them can have an immature immune system based on their age, they're actually doing very well, and we're finding that they're tolerating infection just like other youngsters who get acute COVID.
Well, that's good news and probably really reassuring to parents watching this. Two related questions. Dr. Pacheco, if you could answer this. Lexi asked, should we let our cardiologist know if our child with congenital heart disease probably had COVID? Which was similar to a question from Rachel, who asked, should we follow up with our children's cardiologist even if our child showed no symptoms?
Yeah, those are great questions. I would say it never hurts, of course, to give your cardiologist the information. So there are so many different ways that we can connect through Children's Connect or phone calls. So I think just sort of an FYI saying, I think my child or my child tested positive would be great information for any of our cardiologists to have. It doesn't necessarily mean that monitoring is going to be any different or frequency of follow-up is going to be any different. You're still going to continue your regular visits and watch your child in a very similar way. So I think with the second question sort of relating to that, again, it's not going to necessarily mean you need to come in and see your cardiologist because you think you had COVID or may have tested positive in the past, but it's just good information for all of us to have.
This one was from Melanie on Facebook. Is there anything parents should be watching for post-COVID recovery in any child that has COVID? And then what about a child with CHD, congenital heart disease, or single ventricle? Anything to watch for? Dr. Ballweg, do you want to answer that? Oh, go ahead.
Yeah, so we're seeing the full spectrum, sort of the timeline with a COVID infection. So we have seen some in the hospital with acute COVID, and then especially in the outpatient setting, seeing some who still have lingering symptoms after their acute COVID infection. And a lot of those nagging chest pain, some shortness of breath, some fatigue, things that aren't necessarily specific, but maybe some symptoms they had with their acute infection that have just not completely resolved. So really you're looking for complete resolution of your symptoms from your acute infection or any new symptoms that might be concerning that you didn't have, especially as they may relate to the heart. Are you having a fast heart rate? Are you having an irregular heart rate? Are you feeling dizzy? Have you passed out? All those sorts of things are important to be monitoring for. Mm-hmm. And then for the sort of the post-COVID symptoms that can be related to MISC or that inflammatory syndrome, you want to be watching for prolonged fever. We're seeing a lot of GI or gastrointestinal, kind of upset stomach, nausea, vomiting, diarrhea. If your other respiratory symptoms that are sort of showing up a couple of weeks after the acute COVID infection, could that potentially represent MISC? So you, of course, want to be watching for that as well. And always have an open line of communication with your pediatrician. They're seeing a lot of this in sort of the front lines and can sort of help direct what might be next best steps.
That's a good tip. Dr. Ballweg, you had mentioned MISC earlier as well, and this inflammatory condition. This question came in on Instagram. What percentage of kiddos who had COVID develop MISC and then develop a heart condition?
Sure, it's a great question, and I can share the data we have so far. So with any new emerging disease, this is kind of a moving target. And so as Dr. Putjagel already mentioned, the more we know about our patient population and who's getting COVID, the deeper our ability to be able to predict and anticipate complications will be. And so right now, if we look at the Nebraska Department of Health and Human Services dashboard for COVID, there are about 28,300 people under the age of 19 who have tested positive for COVID. And I mentioned being tested positive because there's probably a great number of people who've had presumed disease who never were tested. And so they're not in our numerical data. And so if we look at the census data in Nebraska from 2018, about 1 in 4 people counted in the census is somebody that would be considered a child. And so if every child, so about 250,000 people in Nebraska got COVID, we would anticipate, based on the number of cases of MIC that we've had, that we would have, out of that 250,000, about 650 children that presented with MISC that required hospitalization and treatment. And so when you think about that, that's about 1 in 1,000 children, and it is about 0.13%. And so by the numbers, it's relatively small, although as we've talked about before, if it's you, it's 100%. And so obviously it's very anxiety provoking for families. When we look at the cardiac effects, which everybody worries about, we can look at our internal data, but we can also look at the data that's been published. And right now, it's really about 50 to 70% of the patients have some degree of heart muscle dysfunction. There's probably about 20 to 40% of the patients have some change to their coronary arteries, which are the arteries that supply the heart muscle with oxygen. And that can be dilatation of the arteries. We have been fortunate, we have not seen any aneurysm formation, which has been reported with MIS-C. We certainly have seen early on a significant number of patients who have fluid around the heart or something called pericardial effusion. Luckily, in the course of treating MIS-C, nearly all of our patients, when they've been discharged home, have had resolution of the cardiac changes, which is really encouraging. Knowing that, we still follow everybody for at least a year post MIS-C, if we can, looking for the evolution or the changes that may occur later. And so we're keeping kind of our finger on the pulse with regards to the heart, because we don't have the natural history to know if this is something that will never manifest again as another complication.
So can you just share a little bit of what Children's is seeing in terms of MIS-C cases that are hospitalized, and then how those patients are typically treated?
Sure. So we're seeing kids anywhere from age about 1.5 to 18 years of age that present with the inflammatory syndrome. As Dr. Puchegel already said, many of them are presenting with lots of GI symptoms. Fever is a hallmark symptom to MIS-C. The kids are testing positive for a prior COVID infection. And so, as was already mentioned, most of these kids present at about 2 to 6 to 8 weeks post-infection. And they have a manifestation of symptoms, which can include injection of the eyes or conjunctivitis. They can have swelling of the lips and the redness of the mouth. They can have a rash, is fairly common, that can be diffuse or localized to a part of the body. Many are having complaints of headache or muscle or joint or bone aches as well. Many have chest pain and shortness of breath in their constellation of symptoms. And so they're getting admitted to the hospital. More than 50% of our patients right now are getting admitted to the ICU because they have low blood pressure and have some instability that requires stabilization. Many of those patients end up on medications through their veins, so IV medications to support their heart and support their blood pressure. And over half of those patients are ending up on the ventilator to help support their cardiac output in their heart. We treat the patients with a medicine called IVIG, which helps calm down the inflammation and provide antibodies. We also give them steroids, sometimes low-dose steroids, sometimes high-dose steroids. And some of them are getting a medicine called anakinra, which also really helps suppress the inflammatory response. In addition to that, they're obviously supported with IV fluids and nutrition as needed and the ventilator as needed. And, you know, when we first looked at our data, most of our patients were being admitted and discharged within about 8 days. Which is relatively short when you think about how complicated some of them, their courses are, and how sick some of them are. In the recent months, probably since November, that's actually changed a bit, and the average length of stay is probably closer to 12 days because more of them are requiring ICU care and mechanical ventilation.
And we don't really know why that is. Why is it more severe now than it had been at the beginning?
We don't understand the change.
Hmm.
It's been reflected across the country, talking to other centers. Other centers around the country are also seeing that the patients are presenting with a higher degree of illness in general.
This next question came from Tiffany on Facebook. Dr. Puchegel, if you could answer this one. do you recommend that pediatric COVID-19 patients have a cardiology workup post-COVID, especially if they are a student athlete?
Yep, it's a great question. I think just in general, for the general population, if they were not hospitalized and were home and have had COVID and fully recovered, they do not need to see a cardiologist. That has not been a part of our follow-up. If they've been hospitalized, we see all of the hospitalized COVID patients and screen their heart and look at it with the ultrasound of the heart or echocardiogram and ECG, and we'll see them one more time as an outpatient after that. The student athlete portion, there's been a lot of people here, Children's Hospital and at the university, sports medicine, who have all gotten together to come up with an algorithm or sort of a protocol for a return to play clinic and algorithm, like I said. And so there's a couple of things that delineate whether you need to see a cardiologist if you are a student athlete. One big thing is age. We're sort of on that preteen 12, 13 and above, where we want to start considering screening them after their COVID infection. It also depends on the severity of their infection. We really think if they've had more of a moderate infection, and that means having fever and body aches, really more significant symptoms that might be similar to a flu and above. So those types of symptoms, even if they weren't hospitalized, we would say, yeah, they might need to be screened by a cardiologist. It also depends on the degree of activity and how competitive of an athlete they are. The more recreational athletes we're not necessarily seeing. And we sort of define that by saying, are you in a sport where you're being pushed? Are you being pushed by a coach? Are you being pushed a lot by peers? So those that are just doing more pickup sports or playing in their neighborhood, we don't necessarily need to see, even if they had a moderate infection. But if you had a moderate infection or severe, and you're on an organized sports team and you're pushed and you're older than that 12 to 13, we will have you come into our return to play clinic. And it's important that you fully recovered as well, that you don't have any lingering symptoms. And we will screen you with a simple blood draw that's pretty specific to the heart in echo and ECG. We've been putting it out there to the pediatricians in the community so they know about this clinic. And you can always go to the pediatrician and ask them, and they can send the referral to us.
It just shows that ability to adapt and pull a team together of specialty teams, a clinic you never would have thought you would have a year ago, right?
Absolutely.
So that's a great resource for families. We had another question. I think this is back to kind of general COVID, and we'll see. Let's see. I know with colds, they have you wait 2 weeks before calling. How long do we wait to report symptoms after COVID? I think I don't know. I don't know if I'm interpreting the question right. Would you say as soon as possible you report your symptoms? What's your take on that question?
So I think that it depends on what the symptoms are and what the severity of the COVID would be important. So somebody who is hospitalized, who goes home and has return of fever, has shortness of breath, chest pain, those are things that I would think would prompt a phone call relatively quickly. And again, we can start with the pediatrician, family practice doctor first, the primary care doctor, and obviously, if they've been hospitalized, we're usually in the know. And so they usually have our contact information, and we always welcome the question, and we'll try to triage the patient appropriately. I think what we're seeing with some of these young people who don't get hospitalized, who have symptoms that persist, in general, when they're lasting a couple of weeks, we are seeing them in the clinic. And I think, like any other virus, it needs to run its course. And so if it's persisting and there's not resolution, it's appropriate to ask if it's the right time to be seen.
Mm-hmm. Yeah, it's a good question. And I know I always hear from our pediatricians, like, call us, like, don't hesitate. If you even have a second thought, call use Connect, call the nurse triage line. So I feel like be in communication with them is always a good default for sure. So the next kind of few questions relate to vaccine and COVID-19 vaccine for children. Amy asked, will children with congenital heart disease be able to get the vaccine in the near future, or are they not recommending them to get it at all? And sort of related, Elise had a great question on Instagram. When a vaccine is developed for kids, will it be risky for a special hearted child? RNA vaccines versus traditional. Dr. Ballweg, do you want to start? That's a big question and it's on everybody's mind, the timing and the effectiveness and all the things. So
they're great questions. I think data is very limited. So as we all know, the initial vaccine trials were on, some of the vaccines were tested on patients 18 and older, others were down to patients who were greater than 16 years of age. So right now we don't have a vaccine for anybody under the age of 16. And one of the trials right now has completed enrollment in kids 12 to 18. In talking with the infectious disease specialist yesterday, we hope to have some data regarding the effectiveness of the vaccines in that age group by the fall. And so at this point, when we have our clinic with our infectious disease colleagues and these questions come up, I think the consensus has been more than likely we will be recommending vaccination of all patients, including those with congenital heart disease, and it will not put them at increased risk. I know some of our families worry about their patients or their children being immunocompromised and us giving a vaccination. We're not giving a live virus vaccination, and so I think it will be recommended. There's certainly a lot more to come with regards to this question.
Yeah, absolutely. What else do you want, Dr. Puchegel, families to know about the care we're providing, all we're learning and doing, your team is doing on this? I mean, you guys are all over this and learning so much in such a short amount of time. What do you want families to know related to COVID and the heart?
It's a great question. I think it's important to know it's a new disease and we are really trying to understand it as best we can. And we are in constant communication amongst ourselves in cardiology with infectious disease. We are really consolidating the care for these kids amongst a core group of physicians. Dr. Ballweg and myself are really the two within cardiology that are seeing all of them. And I think that helps so we can just focus in on that knowledge and try to learn as much as we can and really focus the experience of all the patients that we're seeing. Our infectious disease experts as well are really starting to consolidate the care and going to have a core group of physicians there that are seeing these patients. And I just want people to know that we're constantly looking at new data that is coming out, reviewing our own data, and really just being open and transparent amongst ourselves and families with everything that we know and are trying to do to help kind of combat this disease and all the effects that we're learning about.
This came in a little more recently on Instagram, and I feel like we touched on it, but it does have the surgery component that's unique. Are kids who have had heart surgery at greater risk if they contract COVID-19? Is there any nuance there? What about for that group? Dr. Ballweg?
So I would say our data currently would say they're not at increased risk. We are obviously screening everybody for COVID, not only by asking the history, but they're also being swabbed. And so initially we were certainly saying, let's wait a few weeks if somebody is acutely infected, like we would for any other viral infection, to make sure they've had resolution before we proceed with surgery. But those who are post-operative, we just haven't seen an influx of our patients into the hospital, nor reporting to our group of cardiologists that they're being affected more than anybody else, which is great.
Okay, and this is another question that just came in from Facebook. Is there any information on how COVID affects trisomy babies' hearts in general?
Good. Yeah. I'm not aware of anything
Okay,
that
okay.
is separating it out. I think it's
Yeah.
again, with any concerns with immune function, I have not seen that they are at an increased risk at this point.
Yeah. It just reinforces too, like you have been saying, that communication with your care team, your cardiologist, because they know your child and they know every specific surgery and everything about their condition. And yeah, Dr. Ballweg, I just wanted to ask specifically about research. You know, Dr. Puchegel kind of mentioned this, and I think that's an important piece of this. You know, we talk a lot about care here, but advocacy, research, education, it's all part of our mission here. So anything you would add about research happening and some maybe hope on the horizon related to all of this?
Sure. So for those parents that are participating who've had kids in the hospital, they know that they're being approached by multiple different people to participate, to have their children participate in research that is ongoing here at Children's Hospital and Medical Center, as well as at the university. I know of 4 ongoing research studies looking at acute COVID and MIS-C. And really, these are all collaborative studies with other institutions across the US and North America. And they're looking at different aspects of disease. So some of them are focusing on what does acute COVID look like in pediatrics versus the adult population? What is the biomarkers? So some of them are requiring blood specimens for us to try to figure out what are the markers that may tell us that one patient is going to have a more severe presentation than another patient. And then there are studies that we're involved with through cardiology where we're looking at, in particular, MIS-C, and we're going to be using an artificial intelligence platform to try to predict the outcomes and who's at risk with MIS-C. So there's a whole variety of opportunities for people to be involved with, and I think it's really important. For us, as we both mentioned, we're really trying to define what this disease looks like and make sure that we're offering the best care we can, not only for today and the acute illness, but for the long term.
Yeah. Well, I want to thank you both for sharing your time and expertise on this really important topic. And thank you to our community and our Heart Warrior community that is so strong and such advocates, and for their great engagement and questions on this topic as well. And just to remind everyone, Children's does have an online resource center with content, videos, podcasts, all about COVID-19 in children. And you can find that on our website at childrensomaha.org/COVID. Thank you. Take care, guys.